Another interesting story on the front of The Age is ICU needs overhaul to handle the case surge. Doctors say Victoria's intensive care units will be forced to ration specialist staff and have them treat many more patients to cope if hundreds of seriously ill people hit hospitals by mid-December, as predicted. The forecast came as Premier Daniel Andrews walked back a pledge to establish 4,000 extra ICU beds in the state, saying a scenario where thousands of beds were required at the Melbourne Convention and Exhibition Centre was not what success looks like. I feel it's every single week we have these stories in the different jurisdictions in the country, Sarah, that health systems, despite the level of COVID, are not coping. Given we've seen the roadmap for Victoria, which basically says that they'll be in lockdown until at least Christmas time, this must be pretty concerning. And surely is Greg Hunt going to fire up about some of the seeming mismanagement of some of the health departments around states and other territories?
Yeah, I think the government will. When WA had to, for instance, delay some of its elective surgeries and so on, even though it wasn't in the grips of a COVID outbreak, the government was pretty clear that, hey, we've increased our funding by this much, you've increased it by a lot less, you've also recorded a surplus. And, you know, the government, the federal government has actually been quite careful not to fire too many shots at WA. They're still sort of recovering their reputation since, going in with the Clive Palmer border debate. They know they want to get back in kind of WA's good graces. So for them to sort of have that reaction, I think is pretty telling, that they're not going to shoulder, all the responsibility when it comes to this, and actually be pretty clear with states, hey, you need to do better. And I think it's going to be really interesting and really scary, because as we see the lockdowns wind back, a lot of the reports and modelling is kind of showing, more people getting sick, death rates going up, things like that. And I just think it's going to really show the stress of on the hospital system. A lot of experts I'm talking to, at least, that's yet to come, because obviously so much of the country has a lot of restrictions. When those roll back and there's still a portion of our population not vaccinated, that's going to be a unique problem. That, again, is going to put all this strain on systems that already aren't coping.
Yeah, for sure. We're definitely going to touch on your hometown paper, the Canberra Times. It has a story just about that coming up a little later in the show. But one story also on The Age that really caught my attention is targets on gender parity, in inverted commas, need teeth. In a year where sexual abuse and harassment scandals marred federal politics, corporate Australia quietly marked another milestone in gender equality. For the first time, every company in the ASX 200 index now has at least one woman director, with female representation on boards climbing to 33.7%. Attention is now turning to getting more women into senior management roles, and some banks are linking a company's borrowing costs to gender equality targets. This is the sort of stuff that I guess when it comes to gender parity, it seems to be the private sector is definitely going to lead the way.